This is the module for economic burden of ugly legs in the United States of America. Ugly legs being discolored legs, ulcerated legs, legs that are just heavy and swollen. And it's really important for us to understand when we're planning a strategy, is our strategy going to help our patients? Is our strategy going to benefit our practice? Is our strategy going to benefit the U.S. in general, the U.S. economy? And I think that's very important because sometimes you're doing things that may be helping us and helping the patients, maybe it doesn't make cost effectiveness. Sometimes we might do things, or we would never want to do something that benefited us and did not benefit the patient and maybe hurt the, taxpayers. And these are really key issues. And I want to really kind of make this super clear. The economic burden of venous insufficiency and what we can do to clobber it. Okay, and I don't think you have any idea how big of an economic burden this is. In this paper titled Burden of Venous Leg Ulcers in the United States. This is Venous Leg Ulcers from Venous, and especially the Journal of Medical Economics 2014. They looked at Medicare, non-Medicare, such as Blue Cross Blue Shield, all the insurance carriers that they could get access for, and they looked at the cost of treating venous leg ulcers, venous stasis ulcers in the United States in 1 year. And they did it 3 years, but they only published it for 1 year because it was actually increasing a little bit every year. And the economic burden would be things like, dressings, creams, skin grafts, office visits, putting on Unna boots and different kind of compression. All the things associated with the economic burden of ulcers in the United States. And they came up with an answer that's pretty consistent through different expectations, because people figure it's between $10 and $20 billion a year. Turns out it's right about $14.9 billion per year is spent on managing venous ulcers. Okay, that's 50% of managing all chronic wounds. The chronic wound burden in the United States is $30 billion annually. One half is from venous ulcers. I have another paper here regarding diabetic feet. That's about $6 billion. It's actually a smaller issue. So we can prevent diabetes. Obviously, that would go down. What happens if we can get rid of all leg ulcers? Worker production, 600,000 lost days of production annually. The impact of not treating leg ulcers is 600,000 missing days of work a year. The FDA made a report that they said that the cost just for dressings alone is like bandages is about $6 billion a year, and the cost of drugs, like the medications they use, is another $6 to $8 billion alone, and they think that's going to go up to $20 billion in the next 5 years. I looked at data from Wall Street and private equity, and they're really interested in these companies that treat leg ulcers, that the dressings and gowns and dressings and creams and medications and hyperbaric chambers, and because that's going to be such an exploding industry, because most of these people that have leg ulcers are baby boomers that are hitting 65, which really kind of is getting mature very soon. So this is expected to go from $14.9 billion to $20 billion in the next 5 years. And this is I'll talk to you about this in a little bit, but this was a totally preventable disease, and it's going on right now. Now, to put it in perspective, how much money was spent on all endovenous ablations, be it laser or radiofrequency, in 2016, the same year? And again, most endovenous ablations, about 90% of them are for CEAP classifications 2 and 3. Few 4s, very few 5s, and hardly any 6s, because 6s get thrown into the wound care center where they suck this up here over and over again, like forever, right? So, because they don't ever go, they come back 70% of the time in a couple years. All endovenous ablation procedures done in the United States in 2016, there was 683,000. Doesn't matter what insurer or what kind of device was used, and that cost about $2 billion. Okay, $2 billion we spent on treating ulcers, but $14 billion to prevent them, to make them go away, and we spent $15 billion a year just treating them. If we treated every person who has leg ulcerations, it's estimated about 1.8% of seniors, every senior with leg ulcerations, this year, let's say we did it this year, the cost would be right around $10 billion, and that would go away forever. Okay, essentially forever, because they only come back like less than 5% of the time. So the economic impact of what we're doing is enormous. It doesn't just benefit our patients in terms of pain, discomfort, quality of life, going to the wound care center, getting these damn boots put on. It doesn't just benefit us by growing our practice, allowing us to open more locations, get more access to patients, have a good lifestyle. It has an enormous impact on the U.S. economy. What we'll see in the future is artificial intelligence will not let the doctor who's seeing a wound patient Send them to the wound care center. Don't require them to have an ablation first, because ablations reduce the recurrence rate down to less than 5%, probably less than 2% in reality, whereas sending them to the wound care center, the recurrence rate is 78% in 2 years.